Hello everyone, today I'm going to make a return demonstration on assisting a patient with ambulation using walker. So for the assessment, we're going to assess the patient's ability to walk and the need for assistance, review the patient's record for conditions that may affect ambulation, and perform a pain assessment before the time of the activity. So the possible nursing diagnosis for this return demonstration are risks for injury and impaired walking. So for the materials, we're going to need a walker, non-skid shoes or slippers, non-sterile gloves and PPE, a gait belt, and stand assist device. The first procedure, we are going to review the medical record and nursing plan care for conditions that may influence the patient's ability to move and ambulate, and for specific instructions for ambulations such as distance. Assess for tubes, IV lines, incisions, or equipment that may alter the procedure for ambulations. Assess the patient's knowledge and previous experience regarding the use of a walker. Identify any movement limitations. Then we are going to perform hand hygiene and put on PPE if indicated. Next, we are going to identify the patient and explain the procedure to the patient. Tell the patient to report any feelings of dizziness, weakness, or shortness of breath while walking. Decide how far to walk. So good afternoon, sir. My name is Glastonry R. Hirona. I am your student nurse for today. So pwede mo tanong sa mga full name, sir?
Mostly Japanese results in Thailand.
Kasi mong birthday, sir.
July 16, 2000.
Kasi mong birthday, sir. So, akong bashing account, sir, is to assist you with ambulation using a walker. So kung kamunutan mong paklo, sir, ina lang ko, sir, if kakalipong ka or napakagay ka experience na shortness of breath or sa ba. Would that be okay, sir? Then, we're going to encourage the patient to make use of a stand assist aid, either free, standing, or attached to the side of the bed. If available, to move to the side of the bed. We're going to assist the patient to the side of the bed. If necessary, help the patient sit on the side of the bed. Assess for dizziness or lightheadedness. Have the patient stay seated until he or she feels secure. Then we're going to assist the patient to put on footwear and a robe if desired. So sir, ako kayo assist paglingkod. So, ikuda 1, 2, 3, 1, 2, 3, go. So, kalipo ka, sir. Lara. Then, put on itong robe, sir. Then, ang footwear. Then, we are going to wrap the gait belt around the patient's waist. Based on assessed need and facility policy, then place the walker directly in front of the patient. Ask the patient to push him or herself off the bed or chair. Make use of the stand assist device or assist the patient to stand. Once the patient is standing, have him or her hold the walker. Hands grip firmly and equally. Stand slightly behind the patient on one side. Sir, akong i-auto-visual, sir, pang-assist mo sa timbog. Yes, sir. So, sir, so ako ipatindog, sir, gamit niya. So, pwede mo rin siya gawin i-push mo kagaling sa walker. So, come sir, in 1, 2, 3, 1, 2, move. After that procedure, have the patient move the walker forward 6 to 8 inches or set it down. Make sure all four feet of the walker stay on the floor. Then tell the patient to step forward with either foot into the walker, supporting him or herself on his or her arms. Follow through with the other leg. So sir, yung button, sir, is to move the walker mga 6 to 8 inches. So, move po, sir. Then follow that up yung field. So, sir, very good, sir. Then move the walker forward again and continue the same pattern. Continue with ambulation for the planned distance and time. Return the patient to the bed or chair based on the patient's tolerance and condition, ensuring that the patient is comfortable. Make sure cobble and other necessary items are within easy reach. So, okay. Continue ako, sir. Continue. Oh, sir. Very good, sir. sir. Okay na pang natin, sir.
Okay na.
Family po.
Ayun, sir.
Palingkod, sir. 1, 2, 3, go. Right. Then what we're going to do is remove the gate belts, clean transfer aids per facility policy if not indicated or single patient use. Remove gloves and any other PPE if used, and then perform hand hygiene. After that, the procedure is now, and that will be all. Thank you.